Additional guidelines on rational use of personal protective equipment, setting approach for health functionaries working in non-COVID areas, dated the 2nd of May 2020. This guideline is for healthcare workers and others working in non-COVID hospitals and non-COVID treatment areas of a hospital which has a COVID block. These guidelines are in continuation of guidelines issued previously on rational use of personal protective equipment. This guideline uses settings approach to guide on the type of personal protective equipment to be used in different settings. Rational use of PPE for non-COVID hospitals and non-COVID treatment areas of a hospital which has a COVID block. The PPEs are to be used based on the risk profile of the healthcare worker. The document describes the PPEs to be used in different settings. At the outpatient department, help desk or registration counter and doctor's chamber. At the outpatient department, for chamber of dental or ENT doctors or ophthalmology doctors, and for pre-anesthetic checkup clinic. In outpatient department, for pharmacy counter and sanitary staff. All hospitals should identify a separate triage and holding area for patients with influenza-like illness so that suspect COVID cases are triaged and managed away from the main outpatient department. For inpatient department, wards and rooms. For inpatient department, intensive care units, wards, etc. For inpatient department, wards, critical care and labor rooms. For operation theatre and sanitation. For non-COVID emergency department. Other supportive or ancillary services. Other supportive or ancillary services. For radio diagnosis, lab, CSSD and laundry. Other supportive or ancillary services including kitchen, pre-hospital or ambulance services, ambulance transfer to designated hospital, points to remember while using PPE. 1. Standard precaution to be followed at all times. 2. PPEs are not alternative to basic preventive public health measures such as hand hygiene, respiratory etiquettes which must be followed at all times. 3. Always follow the laid down protocol for disposing of PPEs as detailed in Infection Prevention and Control Guideline available on website of Ministry of Health and Family Welfare India. In addition, patients and their attendants to be encouraged to put on face cover. In case a COVID-19 patient is detected in such non-COVID health facility, the Ministry of Health and Family Welfare guidelines for the same has to be followed. Thank you for listening presentation.